Hello, please have a seat, Mrs. K.
Thank you.
My name's Jane. It's good to see you again. I can see you're here for your 6-week postpartum appointment. How's everything going so far?
I'm doing well, so is John. I've learned so much in the last month.
I'm sure you have. Before we talk more, I want to let you know that what we discussed today is confidential. I'll write it down in your chart, but it won't be shared.
Okay.
It's great you came in for John, for you guys to have a checkup, both of you. I see from your chart that you had a normal vaginal delivery and that there were no complications with his birth. That's great. How have you been feeling?
Okay, a little tired.
That's normal. I need to ask you about complications. So, have you had any pain in your belly?
No.
Any very heavy vaginal bleeding?
No.
Unusual discharge? What about blurry vision or severe headaches?
None of those things.
Fits, dizziness, convulsions?
Nope.
Trouble breathing?
Mm-mm.
Okay, that's good to hear. Are you still having any bleeding at all?
No, my bleeding stopped about 10 days ago.
Okay, good. Sounds like everything's okay with you. But what about your baby? Anything unusual with John?
Not really anything out of the ordinary. He took a while to start breastfeeding, but now he's feeding fine.
Okay, good. So you haven't noticed that he's got any fever, lethargy, poor, weak crying, any rapid breathing or trouble breathing at times?
No.
No fits from him? No discharge or pus from his cord?
Mm-mm.
Okay, that's great. Let's talk about how things are going for both of you now. Do you feel like everything's going okay?
Yeah, overall.
Great. And you're exclusively breastfeeding John?
Yeah, I am. The nurse told me I should exclusively breastfeed for the first 6 months.
Okay, nothing but breast milk. Okay, it's important to continue breastfeeding exclusively for that 6 months. Breast milk is the ideal food for John. It gives him all the nutrients he needs for healthy development and will help protect him from illnesses such as diarrhea and pneumonia. After he's 6 months old, you can start adding complementary feeding. You said he's nursing well, right?
Yeah, now he's nursing well. I had some trouble in the beginning, but now it's fine.
Okay. So have you and your partner resumed intercourse since giving birth to John?
No, not yet. My husband wants to, but I'm afraid it's going to be painful.
Okay, it's okay to wait, especially at least 6 weeks. Have you been told about using the LAM method, the lactational amenorrhea method, to prevent pregnancy?
Yeah, they told me about the LAM method during antenatal visits. Is it really effective?
Well, tell me what they told you. What do you know about this method?
I know that you have to breastfeed only, giving no other fluids or food, and that you need to breastfeed all the time, including during the night, and that you shouldn't be getting your menses.
That's correct. If you start bleeding, you may get pregnant, and you need to be breastfeeding during the day and the night. You should come see us before your baby turns 6 months to get a different family planning method.
Okay.
Now I'd like to do a physical exam on both you and John just to make sure you're both doing fine. First, I'm going to get John's weight, height, and head circumference. Is that okay?
That's fine.